Welcome to Talk with Dr. Agnes. I am your host, Dr. Agnes. Today we welcome Dr. Ade Adeleke, a doctor wearing multiple hats. He is a UK-trained family physician practicing in Lower Sackville, Nova Scotia, lead physician for recruitment and retention in the Central Zone. He is the network lead for Bedford, Sackville, and Four River localities at Nova Scotia Health, and the international medical graduate representative on the board of College of Family Physicians of Nova Scotia. Dr. Akindele, thank you for joining us today.
Thank you for having me, Agnes.
Good. Millions of Canadians are without a family doctor, and thousands of Nova Scotians on the Need a Family Practice Registry are looking for a primary care provider, such as a family doctor or a nurse practitioner. Doctor, please, could you provide insights on the family doctor shortage in Nova Scotia and Canada, drawing from your experience as both a recruited family doctor and a recruitment team member?
Well, as you know, I think the whole of all the provinces in Canada are short of family physicians, and all the provinces have different ways of attracting doctors into their provinces or retaining their residents post-training into the workforce. That problem is not far away from Nova Scotia. However, I think in the last 5-6 years that I have been in Nova Scotia, I have seen a big improvement in the numbers of doctors training locally and staying on post-training as family physicians and internationally trained physicians. So as a recruited doctor myself, I have seen the strides that we've made since I moved here in 2018 till the present day. You're right. There is indeed a shortage of doctors. I think the current statistics suggest that 1 in 6 Canadians do not have a primary care provider. That means they do not have a named family physician or nurse practitioner looking after them. I think that number has been in existence for a while, but locally in Nova Scotia, I think lots of initiatives have gone into reducing that percentage. Hopefully, we'll get better numbers.
Yes, hopefully. And what inspired you to join the recruitment team for family doctors in Nova Scotia? How has your experience as a recruited physician impacted your approach to recruitment? And how do you effectively explain these advantages to potential recruits?
Oh, well, so about three years ago, just short of 3 years ago, the current government, the current Conservative government in Nova Scotia, decided to set up a dedicated team for healthcare professional recruitment. And they put out job offers for doctors that might want to work in that sphere, primarily targeting recruiting doctors internally or locally trained doctors and doctors from abroad. I applied for the position, interviewed for it, and eventually got the position as the Central Zone lead, Central Zone family physician lead. However, that position was, I would say, I even before I got the role, I had been doing a lot of work with speaking to doctors from the UK, especially because that's where I trained. And at the time, lots of people wanted information about recruitment in Nova Scotia, and there wasn't, too much in terms of someone who had done that same journey. I mean, they had recruiters, all right, but I could speak the language. I knew the kind of problems UK doctors faced in the UK, and I also knew the benefits of moving to Nova Scotia. So I felt I was ideally placed to transition from just speaking to doctors ad hoc to doing a proper job with a name to the face, with the backing of the province. And I've been in this position, I think, just short of 2 years now. And it's, so far so good, I would say.
You have been immense support to all of us UK doctors here in terms of settling here and, and integrating ourselves in the community. So thank you.
Thank you very much.
So based on your experience, what are the primary obstacles in attracting family physicians to Nova Scotia? And what approaches have you discovered to address these obstacles successfully?
So I think the way I'd approach this is if a doctor's moving from a different jurisdiction, which means if they're moving from outside Canada, there are multiple things to consider. First of all, immigration. You're going to need some paperwork from your country since you're moving to a different country. Work permits, permanent residency, spousal support. And then you would have to think about licensing, medical licensing. Canada generally recognizes, in the family medicine sphere, recognizes postgraduate qualifications from certain countries, from the UK, from Australia, the United States, New Zealand. But there were
And I think Ireland as well, isn't it?
And Ireland, definitely, and Ireland. And there were obstacles initially to making that transition happen. There were exams and, lots of tons of paperwork. And for a lot of doctors, having to do additional exams and having to submit tons and tons of paperwork, language exams, sometimes stop them from pursuing their purpose or their dreams. And so Nova Scotia at the moment has a dedicated physician stream for immigration purposes, where we help facilitate the paperwork for work permits and spousal permits. We also have worked extensively with the College of Nova Scotia College of Physicians and Surgeons to streamline the exams processes and licensing procedures. And then we've worked, there's a dedicated team here for physician recruitment. So we have community navigators, we have admin staff. We basically, at the moment, I think Nova Scotia's probably got the best sort of recruitment process, because we go to conferences and we speak to recruiters from different provinces, and I can tell you everyone's trying to copy what we're doing here, because the process is really almost bespoke. You do your bit and we sort of help you make that transition. So you asked, what are the things we're doing to make that better? Well, from site visits that are paid for, the doctor and the plus one, usually the spouse, we would pay for them to come in and do a site visit, see different job opportunities before they make their minds up. And it's not tied to employment. You can come and see, and we tend to win over people when they come in for their site visits. We do that, and if you do decide to move here, there is indeed a relocation package where we pay for the doctor and the family to move their belongings or whatever it is they want to do from their primary country to Canada. And then we have ongoing support. So we have made that process hopefully a lot easier. Definitely, I suspect the easiest way to move province to move to from abroad. And even for the residents, the family medicine residents here, for example, this year, every resident was offered a job before they qualified. We said, look, you've got a job if you want it. I think so. Those are very positive things that we've been able to achieve.
That's really great. And how can the lack of family doctors in Nova Scotia be evaluated in terms of its impact on patient care and healthcare delivery?
Well, that is indeed a problem. I think there's enough statistics to suggest that patients or people who have a relationship with a family doctor, be it a family doctor or nurse practitioner, have exponentially better mortality. There's with that relationship, you get sort of ongoing care, preventative care. You have less need to use emergency services because you have ongoing care, and generally health outcomes up. I think, it's every government would want to offer all the people in their province, or a government would want to offer everyone access to primary care. I think, like I said earlier, I think about 1 in 6 Canadians do not have a primary healthcare professional. So the impact is definitely felt by those who do not have that primary contact, so they're left to accessing walk-in clinics or virtual care or the emergency room, which, although it is access, may not be the best access for them. So yes, I think so. Let's take Nova Scotia for example. We know that there is a shortage. So what the government has done is to open up multiple virtual care platforms so that even if you do not have a named primary care physician, you can still access a semblance of primary care. Not the best, but I think it works in this scenario.
I agree with that. And in addition to what you said, obviously the impact includes increased appointment wait times to see the specialist and not having a dedicated primary provider. Obviously, that can have an impact, fragmented care. And
Yes,
when they see multiple providers, they don't have like a comprehensive knowledge of their history.
absolutely.
Mm.
That's what we're trained to do. We're trained to, to see the patient as in totality. So you are. It doesn't always have to be a disease state. Even having a conversation, talk, like they say, from birth to the grave, so to speak. You tend to know the patients. You know their families. You can intervene.
Mhm.
Since you know them, that relationship is so precious to a lot of people. And I think as primary care physicians, that's what gives us the
The
best.
privilege, yeah, yes, absolutely. Yeah. What is the significance of mentorship and support networks in retaining family doctors, especially in underserved communities? And how do you establish these connections as part of your recruitment efforts?
Historically, let's take in Nova Scotia, for example, a lot of Nova Scotia is divided into four zones. So there's the central zone, in which Halifax is the center, I would say, or the capital. And then we have Eastern Zone, Northern Zone, and Western Zone. And the zones outside the central zone have always had a very tight-knit network. The physicians tend to know themselves. They have community navigators. The individual communities have a role in the welcome all the doctors and the keep in touch. And there's that community feel. So in places outside Central Zone, there's a fantastic, sense of community. I know, speaking to my colleagues that are recruiters I'm almost a bit jealous that they have that amount of camaraderie and community feel, because obviously Central Zone is cosmopolitan. It's less tightly knit. But as you know, we both belong to the UK doctors group, and we tend to support ourselves as best as we can. And I think even if you came in through residency, or you came in from the UK like we did, or you came in from Ireland or New Zealand or Australia, as we're getting quite a few doctors coming from Australia now in recent months. That community feel, when you see someone who's done the work that you are doing yourself, there's a bond.
Yeah.
So we support each other. As recruiters, we try and track the doctors as they come in and as they settle in. We try and make sure that they're as comfortable as possible. And the communities are constantly, obviously, every community wants to keep their doctors happy. They do quite a lot of work, and I think my understanding and my feedback so far is that the retention rates are possibly the highest it's been in Nova Scotia ever. So I think that's a testament to mentorship and community, and the work obviously from the recruitment and retention team.
Absolutely. Well, I agree with you. A lot has been done by healthcare institutions such as Nova Scotia Health Authority, the province, and the federal governments to tackle the shortage of family doctors and improve recruitment. However, more still needs to be done faster.
Yeah.
And I had the absolute pleasure of meeting Premier Tim Houston. He recently announced the operational funding for the new medical school under construction at Cape Breton University to train more doctors and retain them to practice in rural Nova Scotia. Obviously, that's investment in medical education. Like you said, there are now new ways and more ways to access healthcare. And that includes, like you said, virtual Nova Scotia, mobile clinics, urgent care centers, pharmacy-led clinics, and as well as positive changes towards reduction of red tape and administrative burden for family doctors. And confirming what you said, streamlining, credentialing, expansion of the scope of practice, interprofessional collaboration with nurse practitioners, prescribing pharmacists, and other healthcare professionals. So, Doctor, could you describe any pioneering recruitment strategies or programs that have successfully enticed family doctors to relocate and retain them in Nova Scotia? What other measures may be implemented to mitigate this situation further and enhance healthcare provision?
So Nova Scotia has a dedicated website to recruitment, doctor recruitment and retention. It's called the More Than Medicine website. So on that website, you can see what jobs are open, both permanent, and at the moment we're working on including locum positions, because we have discovered that a lot of other doctors from outside the province. I was at a recruitment fair only last month in Ontario, and there are lots of doctors, doctors who may want to come to Nova Scotia for a month or two, to see all the goodies we have here in terms of, the weather and the vineyards and Peggy's Cove and Cape Breton, and then do all of that. Want to come in for a month or two and do some locum. So we're doing a lot of work on the locum front. As you know, with the new LFM contract, there is provision for doctors to have some cover when they go away on vacation. I think that's a game changer. As a family doctor, you're always kind of worried when you want to take time away about what would happen to your patient and the workload you might come back to on your return.
Yes.
So I think that's a big game changer. So I feel one of the benefits of the new LFM contract is looking after the doctor whilst they work, and looking after the doctors when they go away on vacation, because you will have some backfill in terms of locum. So I think if you look at the recruitment, all the work that needs to be done to get a doctor here, it's equally as important to make sure when the doctors do arrive that we put in all the things that would make them as comfortable to keep on performing at a high level, which includes covering them for vacation, making sure they have good admin support, making sure their transition in terms of their electronic medical records or navigating how to refer patients to specialists, making sure their licensing and the credentialing is well done. I think all those things will help, to make the transition smooth and the retention even smoother. So yes, indeed, a lot of work is being doing. And the website, again, is the More Than Medicine website, Nova Scotia More Than Medicine website. So you can check that out. And we tend to tell prospective doctors to look in there for job opportunities and information as we get new things on there, because it's a live website. Information gets put on there quite often.
That's good to know. I didn't know that, actually. So I'm going to include that in the description box and a link for anyone that's interested. Thank you for that. The next question is, considering your experience as both a recruited physician and a recruiting team member, what insights have you gained regarding the successful resolution of the family doctor shortage, and what are your aspirations for the future of family medicine in Nova Scotia?
Oh dear, that's a massive question. What would I like to see? Well, I'd like to see a lot more workforce planning, because, as you know, the success of primary care would also mean an increase in the number of specialists that we would have to work with. Because again, if you have an underserved population, if you do get more primary healthcare professionals in that space, more patients will be seen, which means more work will be generated for secondary care. I think work needs to be done to ensure that the work we do isn't dropped when it moves into secondary care. I think that's an ongoing piece. Generally, change doesn't happen quickly, but these sort of problems have been anticipated. I think the advent of collaborative care centers where, we found that a lot of the residents, the newer doctors, want to work in teams, and rightly so, where you have doctors, nurses, physiotherapists, social workers, healthcare professionals, mental health professionals. That's the model we're going towards, as you know, the health home model is where I believe Canada in itself is heading towards. So it's multidisciplinary, multifaceted in a home, not necessarily in one space, but as a wholesome entity. I think that needs to be worked on. That needs to be put in place, because I feel that's where we will get the most satisfaction, the most for the patients, because they can access. A doctor doesn't have to you don't have to see every patient. A patient may want to talk diabetes. They may be better suited to see
a nurse, so a diabetes nurse.
Yeah. So that model is where we're heading. That probably needs a bit of investment, because the previous model was a few doctors in a space, do what we need to do and send out. But if you have that in an entity, in a health home, you can deliver more to the patients. The experience is better, access is better, and less fatigue. At the end of the day, you don't feel bogged down as a doctor or a nurse practitioner that you have to see everyone. And so I think that's what we need to do going forward.
That's great, because it will free up more time for the doctor to see other complex patients, and reduces the wait time to see the doctor if that comprehensive model is implemented.
Absolutely. Absolutely.
Finally, Doctor, we get to know our guests better through our unique Beyond the Conversation feature. Could you share your interests, unique abilities, or thoughts on work-life balance?
Okay, well, someone's asked me this question before, and I think, one of the benefits of working in Nova Scotia is I believe I have a decent work-life balance here. I try not to work too hard because you burn out. Nobody wants to burn out. I work 5 days a week, but I also have time in there for my wife and my children. I've got 2 sons, very active. And of recent, I've discovered the joys of pickleball, which is fantastic. Having some sporting activity, fitness, spend time with your colleagues or your friends, and having enough time to decompress with your family is great. So I think work-life balance is definitely better than it used to be. And I think, that by doing that, I can increase or lengthen the length of time I spend in practice. So let's just say I'm not thinking retirement just yet, just because I've got a good work-life balance.
That's good. And those are the measures being implemented in Nova Scotia, that retention and improving your work productivity and your longevity in practice.
Yeah, absolutely.
Thank you, Doctor, for sharing your expertise on Talk with Dr. Agnes today.
Thank you very much. Thanks for having me. It's an absolute pleasure. Absolute pleasure.
Thank you. That was Dr. Ade Adeleke, a UK-trained family physician practicing in Lower Sackville. He is the lead physician for recruitment and retention in the Central Zone, Halifax, Nova Scotia. We have come to the end of today's podcast. I hope today's discussion has been both enlightening and engaging. Your thoughts and insights are highly valued, so kindly take a moment to share your feedback in the comment section below. For more information on how to become a virtual guest on my show, or for health promotion inquiries, don't hesitate to contact me at talkwithdragnes@gmail.com and visit my website at talkwithagnes.com. Please stay connected with Talk with Dr. Agnes on our diverse social media platforms for updates and content while subscribing to my YouTube channel. Doing so will ensure you receive timely notifications whenever new content is released. If you found this information helpful, please consider sharing it with someone you care about, as together we can spread knowledge and promote better health. Until our paths cross again, keep striving to become your best and healthiest version, and I'll see you soon.